This meeting is being recorded.
Hello, and welcome to the January 2022 edition of Urgent Care Town Hall, presented by California Urgent Care Association and sponsored by Cepheid. My name is Claudio Varga, and I'll be your host for today's program. The California Urgent Care Association is the state chapter of the National Urgent Care Association. If you're a member of UCA and located in California, then you're already a member of CALUCA. And we urge and invite you to become more involved with us. There's a lot going on, and we'd welcome your participation. The Urgent Care Town Hall presented by California Urgent Care Association is a monthly virtual meeting open to anyone and everyone free of charge, where we share and discuss all things related to urgent care, both in California and nationally. For more information about CALUCA, please visit our website at www.caluca.org. That's www.caluca.org. We also welcome your feedback and suggestions for future episodes of Urgent Care Town Hall and invite you to be a presenter yourself. Just email us at info@caluca.org. We've got a terrific program today with two fascinating speakers. We're sure that you'll get a lot of value from this presentation today. But first, on behalf of the Board of Directors of CALUCA and our membership, we'd like to thank and welcome Cepheid for their sponsorship of not just today's town hall, but of the entire Urgent Care Town Hall schedule for the rest of 2022. We look forward to learning much more over the coming months on how Cepheid helps support urgent care practices across America. And just one point of housekeeping, during the presentation, there's a chat function within Zoom. If the audience has any questions to ask our presenters, go ahead and submit those. I'll put those together and present them to our speakers today towards the end of the presentation. So our first speaker today is Krista Charno. Did I pronounce that right, Krista? Charno. She is CEO and Clinical Director of Acute Kids Pediatric Urgent Care. Welcome, Krista. We're very excited to have you. And to follow up her presentation will be Megan Lawson, who is a site reimbursement strategist with Cepheid's Government Affairs Department. Thank you, Megan, also for being here today. We're very excited to have you. So, Krista, we'll go ahead and start with you. I'm gonna get myself out of the way, and if you want to just jump in there and take a minute or two and tell us a little bit about your background and how you ended up here today, and then we're very eager to hear your story.
Sounds good. Okay, well, we can start chatting here while we get the screen shared. Nice to see you all. I wish I could see your faces. I was telling my team earlier, I wish I was in a room with 100 people because that's just the kind of person I am. But it's nice to be here and meet you all virtually and share this really cool experience that me and my team here in upstate New York came across for the past 2 years. So anyways, welcome. Thank you for asking me to speak. I'll tell you a little bit about myself and Acute Kids and how we were born 2 years ago. But I've been a practicing PA for 19 years now, and I've worked in lots of specialties, anywhere from orthopedics, did plastic surgery for a number of years, have always done emergency medicine and urgent care on the side. Urgent care holds a real special place in my heart as I've done it since I got out of school 19 years ago. A couple years ago, I was asked to become one of the first PAs to serve on the board for the College of Urgent Care Medicine. And I was the first PA fellow of the college a couple years ago. And now I'm the current secretary and only PA on the board now. But I'm going to put a little plug here for CUCM. If anybody's interested in becoming involved in the college, which works alongside the Urgent Care Association, feel free to give me a shout out. We would love to have your participation. It's a really fun group, and we focus more on the education part of urgent care. So anyways, that's a little bit about me. Let me introduce you to my baby, Acute Kids, and we're going to talk a little bit about how Cepheid has kind of changed our worlds during this pandemic. Next slide. So I have to say, Cepheid is supporting me for speaking, but they reached out to me and asked if I would be willing to share my experience with the world, because we were in Rochester, the first real solid pediatric urgent care. So who are we? In 2019, August 2019, we opened our doors. This was about a 3-year project leading up to August 2019. Rochester is located about an hour from Niagara Falls. in upstate New York. And, we're a very kind of traditional town. We have a lot of standard urgent cares, which I've worked at some of the private ones and then got involved with some of the health systems as they took over. But we really didn't have something that was unique. I graduated my MBA and wanted to start something that was different. And pediatrics was an untapped market here in Rochester. I'm a mom of 3 kids, so I kind of knew exactly what we needed to do and how to do it right from my experience. So there came Acute Kids. So we opened in August of 2019, or I'm sorry, August of 2019. Yes, 2019. Next slide. And let's just say about 5 months in, bam, this happens. What a change in your business plan, right? You develop these great ideas, you know how you need to do it, you know how patients need to be treated, and then this hits us. So, the real cool thing, or I guess about being a business person and having a background in medicine, is you got to learn how to evolve. You got to learn how to adapt to take care of the demands of your community, right? So this pandemic hits, and it hits hard. We didn't get it as bad as New York City did, but you can just imagine the fear, not being that far from New York City, what was going to happen here in Rochester. So, immediately that spring, so spring of 2020 now we're talking, we had to figure out what we needed to do, not only to stay open, we never closed one day, we never had a 0 day for patients, which is pretty cool. Had a couple 1 patient days, but hey, listen, we never closed down because we needed to figure out how we could still service the community, even though we didn't have school in session and even though people were stuck in their homes and we had illness around. How are we going to adapt our business model to be able to service our community? So of course we started doing testing. We did testing outside. We were one of the first urgent cares in the whole city, if not the first, to implement family testing. We decided, your mom, you got 4 kids, and maybe grandma and grandpa lived at home. How inconvenient is it to send mom and dad and grandpa to another urgent care and have the kids come to us? It just didn't make sense. So, we had to figure out a way how we could be the one-stop shop to help families. So in 2020, we decided to start doing that. In the spring, we started testing families. Then we opened up to antibody testing. And then we had to kind of look into the future a little bit and say, where were we going to be in the fall? School was not in session in the spring of 2020, but we knew that we were probably going to have to get back into school in the fall. And how were we going to make that happen? So next slide. So, again, we took our traditional urgent care model, which you all know about. I think we're all practicing urgent care providers here. Before the pandemic, we had the basics. We could do all of our in-office exams, procedures, labs, and in-office x-rays. We did our point of care testing. So, flu A and B, strep A, urinalysis, occult stool testing, monospot testing. These are all things that we've all done for so many years. Here, easy enough, right? It's urgent care, easy enough, get these things done, take care of your patient right away. Our throat cultures, for example, we would do our in-house rapid streps. And then if it was negative, we would send off the throat culture to the lab, 2 to 3 day turnaround. Hopefully we'd be calling up our patients and taking care of the antibiotic prescription if it was appropriate. And then we'd follow up with our primary care providers, right? Like full circle care. Your patients come to us, we do all these things, we help you out when maybe you're not open, and then we follow up with our notes or maybe a follow-up phone call. But now it's a little bit different. We have this virus that's spreading so fast, we don't have time to do all this send out stuff. I mean, remember back to spring 2020, how long it would take to get a send out COVID test to the labs? None of us were totally prepared. How can you be? But none of us were totally prepared on how we were going to handle something like this. We were having 7-day, 10-day turnarounds for send out PCR testing. And how does that help us when we're out in the community and we have people that need to go to work or kids that need to go to school or parents that have to work and their kids are sick? We need something fast. So in the spring of 2020, I started to kind of lay out, my options and see what was available. Next slide. So I had to look and say, okay, here are my options. How do I choose? So, again, most of you are been practicing urgent care, throughout this whole thing. So we don't need to go into a great deal of detail, but remember the options that we have. So, we have our PCR testing, which traditionally we would be sending away to diagnose some sort of disease. This isn't just, COVID. We have all heard about it for COVID because we've been using it and that thing, but, PCR testing for flu or RSV, or like, for example, we have a kid who gets sick in the hospital and, a viral panel is ordered in the hospital. In urgent care, we don't do that stuff, but that's, PCR testing essentially. Then we have our antigen testing, which can diagnose, COVID on the spot. And then we have our antibody testing, which will not diagnose the active infection, but will tell us, hey, listen, were you infected before? So we had those options to look at. But I had to say to myself, listen, we need the most accurate testing with the fastest results and in-house. How do we help families as fast as possible? Next slide. So again, I went back to, okay, well, we have antigen and PCR testing. These are my two options to be able to diagnose disease fast. So let's look at the advantages and disadvantages, okay? So we have our antigen testing. Now, granted, when I gave this talk maybe 6 months ago, the world was a little different. We didn't have the accessibility of antigen testing that we have now over the counter available for our at-home patients. But we have our antigen testing, which is the basic, the fast, the inexpensive test. Now you can get it over the counter. We know that if there's somebody who's sick, that they can try this test and crush fingers, hope it's positive or negative. But we have to be very careful because sensitivity of some of these antigen tests is a lot lower than PCR. So we're reporting anywhere between some of these brands, 50% maybe accuracy, up to 75, 80, 85% accuracy. So there's a lot of, fluctuation there, but lower than PCR. There's also limited data for the asymptomatic individual. We kind of know that. But interestingly enough, even though we know that we don't have data for asymptomatic individuals, our schools here in Rochester, at least, we're using the antigen screening for schools, hoping that maybe we could pick up somebody that was asymptomatic and shedding enough viral load to pick up. Interesting thought, but hey, we had to do something, right? And then traditionally, we're supposed to be backing up all the negative antigen tests with a PCR. So basically, if we've got somebody who's at a high risk for COVID, and we're pretty concerned that this is active COVID infection, because of that small percentage of chance that we're going to have a false negative result, they really should be backed up by PCR. And we have some urgent cares around that are doing all antigens and then backing up all the negatives. There's a whole business discussion behind that sort of thing. But realistically, remember, we have somebody who potentially has a high risk of COVID infection and we're really worried about it. If the antigen is negative, we really should be backing up with PCR. So that was a variability factor that I really had to think about when I was making the decision about what we were going to do at Acute Kids. So then I started looking at PCR testing. Again, the basic science of PCR testing is I tell our parents and patients, it's like a DNA test, right? So this reagent or fluid that's inside these little cartridges amplifies the DNA of the virus. That's what they don't understand RNA. So I say DNA. It amplifies the DNA of the virus. And so it's so sensitive that this test can pick up the virus, even if it's come and gone and left little DNA particles behind. That's how good it is. And that's why we can test positive with PCR, weeks to months later. So, again, wow, amazing that this technology can detect something that is so small and maybe a viral load that's so low. So that was pretty cool. I found out, hey, listen, we could do this in our office. We could get results in 30 to 35 minutes. So wow, that was pretty impressive to me, that we could bring PCR testing in-house. And the CDC from the beginning has always said that PCR is considered the gold standard for testing. And they keep saying that repetitively. But of course, there's challenges to bring a PCR in-house, that I'm sure we'll talk about in a little bit. Next slide. So our world, again, is totally evolving. As I said, I gave this talk 6 months ago when we were rolling off RSV season, and I think the next slide addresses that. But we have these new variants that show up. We have all these changes. We need something solid that's really going to help us here. Help us shut down our viral vectors as quick as possible, because in reality, in a pediatric practice, my parents can't afford to be out of work for a week waiting for their kids' tests to come back. And we have a state mandate in New York State that requires that basically any kid who has any symptom that could be related, and we're talking about headache to simple runny nose to we sneezed a couple of times, and some nurses are worried about that, to upset bellies, we got to make sure it's not COVID. Because if it is, and that kid comes to school, then we risk exposing, the classroom and lots of other folks. So we got to shut this down quickly. And that's a state mandate we have. So we need something that's fast and very good and very specific to COVID infections. So as our world evolves, again, we got to have the best products, the best accessibility. We got to help our families to make sure that we're shutting this thing down as fast as possible. What I love about this slide particularly is the note that we have a lot of infections that are asymptomatic and have very low viral loads. As I'm sure you all have experienced in the recent couple weeks, well, maybe a month and a half or so, depending on where you are in the country. Right now, we're hitting the peak surge here in Rochester, praying that's going to come down in the next 1 to 2 weeks because our hospitals are, overflowing and we're having trouble here. But we have infections, we have people that are vaccinated now, and we know that vaccine helps us in regard to the viral load, that those folks that are vaccinated tend to have a lower viral burden and therefore are maybe less infectious. But if we look at the viral load itself, it's lower. So they may not be as sick as the other folks. Doesn't mean we still shouldn't be testing them and making sure that everybody is remaining safe. So again, we need a test that's going to be really good, really solid, that's going to pick up even a small amount of viral load there, which is why this DNA technology really continues to be the best to control these viral vectors. Next slide. So again, not to beat it too much, we kind of already talked about where PCR again tends to be the gold standard here. We can detect viral load beyond that 72 hours, which tends to be a little bit more sensitive, than an antigen screen a day out. If you have that person who's been sick for a week, let's say, and then they've had a cold for a week. We'll just use simple things. We've had a sinus infection or a cold for a week, and all of a sudden they find out that they actually had a direct exposure to somebody. Well, the risk we run with antigen testing is it may be negative. So is that person gonna, go out in the world? Or should we, now that we have a patient who has a high risk of having COVID, should we PCR them? Because that's probably gonna be positive if it's COVID. Now, granted, we're outside of the 5-day window now for isolation quarantine, we're not gonna go there. But the reality is the sooner we know about a result, the sooner we can take care of our patients, and the sooner we can take care of our patients' families. So that's why this same day patient diagnosis and appropriate treatment, I love it. So with that said, I can tell you that in spring of 2020, I laid out all of the platforms that were available to me. I looked at the cost of my supplies, the turnaround time, I looked at data and studies and efficacy, and that's how I decided that I was going to choose the Cepheid platform. Next slide. So I mentioned a little bit ago about RSV. So what is so cool about the Cepheid platform is that I was going to be able to take care of my kiddos here in the office with one swab. So one swab, multiple things at once. Now, historically, remember, say we had a sick kid that came into urgent care, before the pandemic, we'd be doing flu, RSV, like multiple swabs for multiple pathogens. When I found out that Cepheid was coming out with these, what we call multiplex platforms, so one swab, multiple pathogens, that was like a total complete game changer. For those of you that take care of kids, remember this past summer? Who can forget it? I mean, this was one of the worst summers in pediatrics that we've ever seen because we got completely hammered by RSV. Hammered. RSV comes to us in the wintertime in a normal world, but this summer was totally out of the norm and we got hammered with RSV. But the challenge with this pandemic is, how do you know it's RSV? How do you know it's not COVID? How do you know it's not both? We did see both, by the way. So, that was really cool for us this summer to be able to have this in-house where we could evaluate our kids pretty quickly. We also could use that information to educate our parents. You have a lot of what we do is education, right? Encouraging our parents and families to make good decisions and, telling them what to expect over the following week or so. A COVID kid might be a little bit different than an RSV kid. Throw asthma in there, you have potential for lots of problems. So it's always really good to be able to know what you're dealing with. And this helped us this summer. So, again, we saw mixtures of RSV and COVID. Now, we're into the winter season. We've got flu A and flu B circulating around. I can't tell the difference between COVID and flu A and flu B. And if you have COVID, your kids got to stay out of school. If they have flu and they feel better, and maybe you treat them with Tamiflu if that's an option, they can go back to school. So again, there's a lot of important factors that come into play when you actually know what you're dealing with. Next slide. Okay, so this is our little platform, and I think we have a picture of my lab station in a second so you can see. We were the first ones in Rochester to have this platform. We're the first urgent care, let me say. First urgent care. At the end, you're going to see the little video clip because, of course, we got a lot of marketing out of the whole thing. So this is our little baby. This is our Cepheid Gene Expert Express, and he's very small, sits on the counter. These little machines come in different sizes. The one that has 4 bays in it that you see would be the more typical one that you'd have in your office, but you can order them, bigger. And then the hospital systems, they have ones that, could run, 50 to 100 of these things at the same time. So what I tell parents a lot of time is, yeah, it's a rapid, but rapid only means I can do it here in my office. Doesn't mean anything about the test because you can have rapid antigens or PCR, but my machine that we have here in this office, it's the same thing the hospitals are doing. It's just on a smaller scale. And that helps give some credibility to the tests themselves. So this is the Gene Expert Express. And these little cartridges here that you see, they can check for COVID, flu A, flu B, and RSV with one swab. So total game changer for the kids. One little tiny swab, get in and out, get some good boogers, I say. And, then we put in this machine and we know, within 36 minutes, what we have to deal with here. And as you can see, here's the positive percent agreement, negative percent agreement, pretty solid. This is solid data. So really good accuracy here. Next slide. So at the beginning, when we first got our platform, we had like the first generation little cartridges. Now they've actually updated or juiced it up and called it now the Plus. It's the same pathogens, but now they've added, more ability to recognize some more gene patterns in there. So it's even better than it was to start. So again, it's intended for the simultaneous qualitative detection and differentiation of COVID, flu A, B, and RSV. And we call it the Plus multiplex cartridge. Again, very impressive. One swab for 4 pathogens. Next slide. So the same machine also does other things. You can choose the option to just do COVID testing if you'd like. So they have COVID only cartridges. So for when we get out of flu season and out of any sort of respiratory risk for RSV, then you can choose to get the COVID only cartridges. And what's interesting about Cepheid, and it's actually very smart, they stop producing some of these cartridges at certain times of year when the demand, makes sense. So right now it makes sense to get the multiplex because we want to know if there's flu and COVID there as well. But there is the ability to order the COVID only cartridges as well. These also, run pretty quick. You're going to have results in about 45 minutes or so, but positive results for these ones tend to kick out a little bit quicker. So you might see results sooner than that. These ones are perfect for your travelers that need a PCR test to travel, like for example, the international traveler. We were one of the only urgent cares in our city that would actually help the travelers, because you have to have a result within 48 hours sometimes. It has to be a PCR. So we could do this. Not covered under insurance, so we had a self-pay fee schedule for that, but we could help these people when nobody else could. And then again, the return to school mandates, when we have to be PCRing our kids to get back to school to satisfy the state mandates, this was also really helpful for us. Again, you can see the data down there, really solid positive and negative percent agreements. Next slide. Okay, so now we're going to talk a little bit about how we implemented this technology into our practice. And I can tell you this process probably took a good solid year and a half to really nail down. And it changes every 3 to 4 months, depending on what sort of demands we have to satisfy with our kids in school and all of that. So this is how we do it. So we first screen all of our patients. So we use a contactless registration process from the parking lot. Everybody takes care of all the paperwork before they even walk in our door. As you all have learned, it's tough when you're a really high volume urgent care to keep people separated and safe. So that's been our method. We do everything outside or from their home before they show up. And then when they get there, they call us from the parking lot. And then we either do drive-through testing if the weather's not too crazy. We do live in upstate New York, it is wintertime. But if it's not too crazy, we'll do it right outside. We're an old bank, and so we use the drive-through. And we will test them outside, or we will call families in one by one to do the test, and then go back to the car when they're all set. We don't make anybody wait. Because of the sheer volume of this thing, it would be unrealistic for a mom with a bunch of kids to wait. So what we do is we do the test, we place it, you can see the little test tube containers, they're white there with little sections, and we line them all up depending on who arrived. And then as we put the test into the machine, it's actually so easy to use. Then we will take the test tube and put it into the next little slot as a running test. And then we have our bins for the paperwork. So again, there has to be a process, because we want to make sure that every patient is contacted. We print a school note because the school needs evidence that we did the test in-house and have a copy of the results. And then the state data has to be entered for every single test. Now I can tell you, since I've done this presentation months ago, we now have implemented an automatic reporting system to the state. So once my team puts the results into the computer, into the patient's note, they are automatically shuffled off to the state database. So that's a massive time saver for us. But you can see, again, there's steps involved, but we have been able to very easily see 80 to 90 kids a day. We are open 10 hours a day. We are a walk-in facility with no appointments, and we can easily see that many kids in a 10-hour day, and doing all of this stuff with the right team and the right process. So it's very possible to implement this into your practice. Next slide. This is the data sheet that we formulated so that my team kind of had the checklist to make sure that we were meeting all of these components. The first part of the sheet, you can see we actually don't need too much anymore because it's automatically uploaded to the state. But these are questions that New York State requires for every test that they follow. And then down below, you can see did we run the test? Were the results printed? Did we call the patient? Again, patient phone calls and communication during this time we feel are really important. Again, we're kids. We've got a lot of freaked out parents, but those conversations surrounding a positive or negative test are really, really, really important to set the expectations up for what the next week to 2 weeks is going to play out. Also exposures for parents and work and all of that sort of thing. And then making sure our providers did the note and making sure we did the school note. So that was kind of our checkbox system that we laid in place to make sure that we weren't missing anything. Next slide. Okay, so hopefully we've kind of hit a lot of those points. Hold on, Minnie, for 1 sec. Hit a lot of the most important points about why we brought this into our practice. I can't tell you about the specific costs and numbers and all of that, because that's extremely variable depending on where you are in the country, what sort of insurance plans you have set up. So, you know, it wouldn't be beneficial for me to share mine with you. But if you have any questions, you can feel free to reach out to me directly. I'd be happy to help you or share my experience there. But, you know, it's not just about the numbers. And I think as clinicians, if any of you are clinicians and practice owners, you know, remember why we're here and why we're in medicine. And I know that's been hard over the past, you know, especially the past couple of months with the most recent surges. It's like digging down deep and saying, why are we really here? Why are we really doing what we're doing? You know, we're here to serve people and to help people. And no matter how overwhelmed we are, you know, that is really why we went into medicine. And so when I was looking to figure out how we were going to help the community the best, I wanted to pick the best testing that was going to be for our patients. And I can tell you that from making that decision and being that person or that practice in Rochester, the first one to really think outside of the box, it just completely blew up. We got marketing out of it, which you'll see in a second. Pediatrician offices like embraced us. Remember, we were only open for 4 to 5 months before the pandemic hit. No one knew about us. So testing families exposed us to people that didn't know we were around. We have people driving an hour to see us now, and it's beyond the COVID testing. So maybe their family came for a COVID test a year ago, but now their kid has an ear infection and they can't get into their doctor. Who are they going to come see? Well, they're going to come see the people they know. So again, it's not just about the numbers. Have we, you know, has it been financially beneficial for acute kids? Well, of course it has, but the financial benefit doesn't come so much on your bank account. The financial benefit comes to all the outreach that you do and the amount of people that you help that will come back to you at some point. So here's a great media clip. I love this. I'm so glad they included it. So go ahead, Mindy, you can play. Hopefully it works.
Urgent Care is offering a new, quicker COVID test, and that's giving parents more options for their kids. The 4-in-1 rapid nasal swab can provide test results in a single day, at times within a half hour of taking the test, meaning parents can present rapid test results to schools more quickly. Acute Kids Pediatric Urgent Care is the first practice in the area to offer this test, and they're calling it a game changer.
The turnaround time could be anywhere from 24 hours to a couple days, depending on volume at our local labs. This platform gives us the ability to now run these tests in office. So we will save kids and their families days of time for waiting for a result. The results are 15.
You should check with your insurance company to see if your child is covered for the rapid test. Testing will start next week inside Monroe County's yellow zones.
The Jordan Health Respiratory Clinic on Holland Street.
Okay, so thanks, Mindy. But as you guys can see, you know, that was just one of our local news stations who, you know, found out that we had this test, and we turned it into an opportunity to really share experience and get acute kids exposure. So it's all worked out really well.
Thank you so much, Chris. So that was very, very, very interesting. And thank you for that. And there's we have a slide here introducing Megan Lawson, who is with Cepheid and is going to give us a little bit of insight on maybe the nuts and bolts of reimbursement and coding and a few things like that. So which we know just goes along with this business. So thank you very much for that. And we're very excited to have you here with us today.
No, thank you guys for having me. So hi, everyone. My name is Megan Lawson. I am the lead alternate site reimbursement strategist at Cepheid within the Government Affairs Department. And I look forward to providing what is hopefully some helpful reimbursement information around the tests you just heard Krista talk about. So one of the things that is unique about our test is that we went and got a PLA code for it. And I know that these are new to a lot, so figured we would start there. So a PLA code is a proprietary laboratory analysis code. They're in addition to the CPT code set approved by the AMA. So they are level 1 CPT codes. They are just alphanumeric, which means that there's a letter included rather than 5 numbers. These codes are created for labs and manufacturers who specifically want to call out their test and identify it specifically. So that's why Cepheid went and got a PLA code. This allows the providers, when they're billing the payers, to know exactly the test that is being performed, so the accuracy and the targets in which were done. And it then allows the customer to leverage that fact with the payer to say, this is the Cepheid test. This is the one that has these performance features and these targets built in. So the quality of the test then can be highlighted as well. So then what are those PLA codes for the Cepheid assay? So we actually have 2. So for those who are unfamiliar, the assay has the ability to select targets. So the same assay that Krista was talking about, that is SARS-CoV-2, flu, and RSV, can be performed for all 4 of those targets. It can also be run to just do SARS-CoV-2 and the flu A and flu B, and then just SARS-CoV-2 by itself. And in this plus version of our assay, the SARS-CoV-2 version has 3 genes to detect SARS-CoV-2 to help address all of those variants that are coming out and to make sure that we're providing true and accurate results for SARS-CoV-2. So when you perform all 4 targets, it's PLA code 0241U. When you do just the SARS-CoV-2 and flu, it's 0240U. And then the SARS-CoV-2 standalone CPT code is there at the bottom at 87635 with the corresponding Medicare reimbursement rates on the right. So one of the things that Cepheid likes to recommend is for urgent cares before bringing in the test to do their due diligence. So our steps in doing that is determine who those top 5 payers are for your facility. Is it Medicaid, Medicare, your local Blue Cross plan, United, Aetna? And then take those codes that were on the previous slide and pull up your contracts or your fee schedules. You can also reach out to your payer provider representative and say, we're looking to bring on this test. These are the applicable codes, and verify what that reimbursement rate will be for you. Additionally, Cepheid has an entire team here that can help. So any questions that come up in the process, we are happy to assist with, whether it's providing additional information around the tests, additional information around the payer policies, or just answering any generic questions that maybe the payer had or that you have around the test itself. So these are our 2 main resources that we really recommend. So any questions that you have, if you email the us-ga@cepheid.com email address, it hits all of our inboxes and the entire team is ready to assist and step in. We also then have the code map website that is listed there below that provides all the applicable codes for all of the Cepheid assays, the Medicare rates and Medicaid rates by state. And if there are any questions, I'd be happy to answer them. Oh, Claudia, I'm not sure I can hear you. Sorry.
My bad. I keep I want to make sure that I'm muted and then I forget to unmute myself. It's like the curse of Zoom, right? I mean, how many times have we done this the last couple of years, right?
Yeah.
So we don't have any, I'm waiting here for some specific questions, but, maybe I thought one of the things that would be interested is maybe, Krista, maybe you can go back in time a little bit. And I know you touched on it, your thought process and evaluating and arriving at this, but, maybe between you and Megan, what were some of the things that, I don't want to say hangups, but things that turned out to be more critical in your process of choosing this particular product, choosing the company itself? Because we all know when we make these decisions for our facilities, it's more than just what's on paper. It's more than just the price or things like that. You're looking at whole organization. Am I partnering with these people? Who am I linking up here with? And walk us through that a little bit. What you went through in the past and arriving at the situation that you have now.
Yeah. So, I mean, the whole process actually was quite easy to implement, because this PCR technology was so new to urgent, I say new to urgent care, but I would have never thought to implement PCR before the pandemic. So in spring of 2020, I just had to pretty much pull the data in and look at the data and look at the machines. I think at the time, Abbott was like the only one that was out. And I just had to start comparing, efficacy, and then I had to look at cost and packages and supply price, and you compared that to reimbursement rates and so forth. I mean, back in 2020, I think we were still, this was before the codes were really like solid. But I didn't mention that it took us like 6 months to get our platform. I think I signed my agreement in maybe April of 2020. Hoping that would arrive in the summer, ready for the start of school, and we didn't get it till October. And then we started utilizing it, and the pediatrician offices in town said, "Wait a minute, what's going on here? How can they do this so much faster than we can?" And now, they all jumped on board, of course, about 10 months too late, and it took them about 5-6 months to get their platform. So, the only challenges that I've had throughout the whole process is cartridge supply, but we all have the same challenges. Demand has greatly outweighed the supply chain. I mean, we see that in our grocery stores too. But with this sort of thing, we stock up, and then production goes down a little bit, and then we get nailed with a big surge. And so supply has really been the greatest challenge for us throughout this whole process. But I mean, I don't think I would take back anything that I did. There's no decisions that we made that I would retract on for sure. This has been nothing but incredible for our community.
Got it. Well, that's great. Thanks for that. We do have a question from a clinician that said, Krista, do you only use the test on symptomatic patients, and how about known exposures? Maybe you can walk us through a couple of clinical steps in your decision making when you're face to face with the patient, how you arrive at this.
Yeah, so that's actually a great question from what we just talked about to kind of phase into, how do you make the best selection for using these cartridges for folks. So one thing that we have here in Rochester, and I'm not sure if they have it in other parts of the country, maybe they do, is we have a state mandate in place. And prior to just a couple weeks ago, all the kids had to have a PCR to go back to school, no matter what. So again, headache, runny nose, fever, anything, if they were going to get back into school, it had to be a PCR. So, there goes my supply. You easily can see, you get 80 cartridges a week, gone in a day, or 2 days, depending on, what's going on. So those kids got the cartridges no matter what. But let's take the example of a family. Okay. Let's say we have mom and dad are positive and they have 3 kids now. Let's forget the vaccine for a second, because of course that throws in a wrench. Before the kids can get vaccinated, they're all little kids and we have exposure. The reality is because we are so constrained with supply, we just have to make smart decisions, because we're going to run out if we just give it to everybody, right? So mom, dad, 3 kids, would you use the rapid cartridges on the 3 little kids when it's not going to change behavior? Probably not. Because everybody's going to stay home. So if they still want that testing, that would be, maybe you want to utilize your health system lab for that. Send it out, because it's not going to matter if their swab takes 2, 3, 4 days to come back. It's not going to change behavior. But then let's say, now let's take the vaccine in. And here in Rochester, we have guidelines from our county health department that says if we have a vaccinated kiddo and mom or dad's positive, they can go back to school as long as they have no symptoms. But yet testing is recommended at 5 days. That would be a high risk exposure. If the kid's asymptomatic at 5 days and we really solidly got to know if this kid's safe to go back to school, maybe use a cartridge for that kid, because that's going to give us a great result. The kid can still go back to school. That's going to affect the behavior of the family. So I guess there's a good example for that sort of thing.
Yeah, definitely. Well, that's very, very, very helpful. So, I think, I don't know if it would be yourself or Megan, I'm going to kind of put you on the spot a little bit as a representative of Cepheid. Talk to us a little bit about, current availability of supplies and things like that. To the best of your knowledge, you might not be in that particular end of things, and approximate cost or some of the financial things. Maybe, Crystal, you could shed a little bit of light on that and how that's worked in with your practice. I'm guessing with some of these travel things, maybe you've done some self-pay business or things like that. I'm not sure. The last couple of years, we've all kind of mixed and matched and tried to figure out what to do given the different, patient groups and so forth. So anything along those lines?
Yes. So from my perspective, I do not have line of sight into allocation. We do try to keep a clean wall between reimbursement and sales for compliance issues, but I'm happy to follow up, Claudio, if that's okay, with some of that information. So everyone on the call has it.
Yeah, I'm sure some, our viewers typically, of course, what does it cost and what's involved and, the term, we know that usually. So was there, I'm guessing there was a contract or something with certain allocation or certain usage per month or per year or something like that. Crystal,
yes.
how did you find? Were you comfortable with that? Did you find Cepheid to be easy to work with and flexible?
Yeah, and I've actually had this conversation with a lot of private practice offices in town, that have considered getting the machine and actually are having a lot more trouble using the machine and supplies. I think and I believe, granted, I come from the urgent care world, but this thing is made for urgent care because we are volume based. Primary care offices control their volume. They have a certain amount of sick appointments and a certain amount of, like, if we talk pediatrics, certain amount of well visit appointments. And then, they're very regimented. Their appointments can be 15 to 30 minutes for one kid, where we are used to, really efficient, effective care very quickly. And again, based on volume. So it was very easy for us to meet the allocation, and so at the beginning, when our initial contract was given to us, I'm not allowed to talk about specific numbers, but I can share with you that, they said, if you buy this many cartridges a month, for this period of time, you get the machine for free. And I was like, oh, that's no big deal. I can easily beat 100 flu tests a month, you do 100 flu tests in a week. It's easy for urgent care to meet those sorts of things, where a primary care office, right, they have struggled, and some of the practices in town have struggled to meet that. To answer the reimbursement question, again, I can't state specific numbers, but I can tell you that this has been very worthwhile for us from a number standpoint. Now, granted, there's some plans, like some of our Medicaid plans or, the plans through the payers, which for the kids, we may not make a ton of money on these cartridges. I have not lost money, I can tell you that. I've not lost money at all. And the reality is, again, if we step outside of the box and think about helping people, you may not make money on a cartridge, but you might make money on when that kid comes back for an x-ray or an ear infection or whatever. So the return comes on the other end of being available to help somebody for something like this. And then you think about, again, I'm peds. What happens when you have an adult that needs to travel? Well, that's not covered by insurance. So what we did is I cold called all the urgent cares in town, and I found out what they were charging for their self-pay stuff. And then I either matched it or made it seem more appealing. And so now we get all their patients because they come over here to us. They know that we can help them with a PCR in-house, for this specific cost. So you make a lot of money on those cartridges, on those sorts of patients, which tends to offset the ones you may not make as much money on. So again, it all works its way out, but I don't regret getting this thing at all. I mean, really, it's helped us so much, helped so many people.
That's very helpful. And we've all been down that path with a variety of different, testing platforms and situations. And at the end of the day, you're not going to make money. This is an exception with some of the self-pay testing and things like that we've seen for travel and stuff. But typically, the lab is not a big money maker for practices. It really comes down to pleasing patients, referral, repeat business, patient convenience, things like that. Any parting thoughts or nuggets of wisdom as far as you, Krista, as a clinician, how this platform has made your outlook more positive, in providing care for patients? I mean, you did share with that some of the, positive remarks from patients, but what thoughts would you like to leave our audience with in terms of how you internally feel now that you're being able to utilize this platform in delivering care?
Yeah. Well, I can tell you nothing feels better than being able to call a mom an hour after a test and say, your kid has RSV, or your kid doesn't have RSV, or your kid doesn't have COVID. And, you imagine a mom with a 5-month-old baby or 6-month-old baby who's got a cold and they're all freaked out. It's going to affect the nanny and the grandparents. There is nothing more rewarding than calling that parent an hour later and saying, guess what? You guys are safe. Or your kid's on day 3 of, this bad illness, it's RSV. This is what we're going to do together over the next couple days. And this is what you're going to watch for. I mean, that is just so satisfying as a clinician, as a parent, being a coach for these young moms and so forth. I mean, that's just, that it's pretty cool. It's pretty cool because we've never been able to do this. I mean, all the years I've practiced medicine, you've never been able to really, really impact somebody like this before. So it's pretty cool.
I mean, you're in pediatrics, and that's that's like ground zero patient contact, anxiety, family pairing. I've got 2 little kids too, and my wife's even a nurse, and I don't know if that's actually even worse, to be honest with you. But when the kids get sick and all of that stuff, I think it's worse. I think it's worse actually. So healthcare families, we're terrible. But no, I totally hear you. We're all about patient care, patient satisfaction, repeat business, and just developing those relationships. And anything that you can do in the long run, it's just going to pay dividends. So we had somebody else to give us a question. Maybe I'll throw that out to you, Megan. What are all the tests that this machine can do? I mean, I think we discussed 4. Is that it, or is there more? Or?
Oh, no, there is more. So Cepheid has over 22 cleared or approved assays from the FDA. So from a CLIA waived standpoint, we also have Strep A, then the SARS-CoV-2 standalone flu, as well as flu RSV, and then our 4-plex assay. And then we have a whole host of other tests as well for moderate complexity too. So
same machine?
The same machine. It's just a matter on if they are declared waived.
Sure. No, I hear you. Yeah.
That's what's unique about Cepheid is the cartridges all look exactly the same, all run in the same systems. It's just a matter of how many bays you have.
Yeah.
That's impressive. As you know, some people now are putting urgent cares in very small, we've honed it down from big facilities to just what's the minimum amount. And that really fits in with that because, sometimes in your lab, you've got very limited space and you can't have 7 machines. And it sounds like this one really cuts down on that sort of thing. So that is very, very good to know. So
I didn't mention we also have strep. We use the strep cartridges as well. Yeah.
Got it. Super.
Same sort of, game changer situation for parents and starting antibiotics sooner and things. So that's also very nice.
Oh, and sexual health, we have CT&G assay, TRIC, and others as well. I know that's a popular one within the urgent care space.
Wonderful. Well, we're winding it down a little bit. I'll go around. I'll come back to both of you with any parting remarks or anything that you want to leave us with. Megan, I'll go with you first.
Sure. No, thank you guys for your time. And we truly are here to be a partner. So if there are any questions that you have, please feel free to reach out and we look forward to seeing how we can help.
Great. Thank you, Megan. It was a real pleasure meeting you today. Thanks so much for your information. And so now, Krista, thank you so much. You shared so much with us. So I'm sure everyone found it very, very, very valuable. Anything that you'd like to leave us with?
No, all I'm saying is let's work together to get out of this thing so we can be together in person again. How about that?
Amen. I hear you. I hear you. I hear you. So yeah, thank you. And on that note, we'll close and we just want to again, personally on behalf of the board of directors of CALUCA and all the members and all the healthcare people everywhere, just we want to thank everyone for their service, their dedication, their commitment. My words are useless really to describe the things that I've seen in person, the commitment, the effort, laughter, tears. I mean, it's like an ongoing, never-ending MASH episode. It's just it just goes on and on and on. And so many people lost, and just the struggle continues. But it seems to be getting better. There's light at the end of the tunnel, and so we're going to dedicate this show and all of our programs from here on out to just the folks there on the front lines, dealing with the situation. And we wish everyone the best, and stay safe out there. And thanks again. So we'll look forward to seeing you again next month, the second Thursday, 12 noon Pacific Standard Time. And you can check our website for more information on our next program. Thanks, everybody. Take care.
Bye.